big issue that I see with men is urinary urgency, frequency, and also not being able to start the flow of urine.
We've spoken a lot about female anatomy, but can all these things apply to male anatomy too? Can Kegels help or other pelvic floor exercises?
Yeah, for sure, for sure. Men tend not to have as many issues with prolapse, although rectal prolapse can happen.
Mm-hmm.
But definitely it's more of a female thing. They can have bladder issues. Often men have bladder, they can have incontinence issues, especially after something like prostate surgery, which is
Mm-hmm.
actually very common. And it's a big deal. And Kegel exercises can definitely help with that. A big issue that I see with men is urinary urgency, frequency, and also not being able to start the flow of urine.
Mm-hmm.
And this is where you really want to focus on relaxing the pelvic floor muscles first. Often, this is an issue of too hypertonic pelvic floor muscles.
Mm-hmm.
You want to focus first on that letting go, and then you can begin to work into more strengthening exercises for the pelvic floor, which is going to help with coordination and control. And that will ultimately help with sex, finding and maintaining an erection, all of those things. So pelvic floor exercises definitely can help. I do have this is my male model right
Mm-hmm.
here. So you can see the muscles it's the cutest model. It's just a piece of paper really that you fold and make it into a mini pelvis.
Mm-hmm.
Here we have from the outside, the superficial pelvic floor muscles, and you see they're quite similar to the female. It's just that there's one hole instead of two.
Mm-hmm.
And from the inside, we have the same expansive muscles. And this would be, if a male is going to go to a pelvic floor physical therapist, they would be receiving most likely a rectal examination to see what's going on in the pelvic floor muscles. So an examiner can actually see if there's pain, if there's tension in the pelvic floor, as I'm showing with my finger right here. It's quite helpful to have an examination, even though it might seem intimidating. It's really, really worth it.
Do people find that uncomfortable in your
experience? I mean, back when I was in clinic, it did. I mean, some people really weren't ready for it on the first time. They needed a moment, give me a minute here, to prepare, because they're going to a physical therapist and probably expecting some exercises.
Yeah.
They're not necessarily expecting a very intimate, a personal examination. And so females usually are examined vaginally. Sometimes their physical therapist will examine rectally as well,
Mm-hmm.
because the rectal approach helps you really access those deep, especially the back, part of your pelvic floor muscles. So some PTs will do both approaches, but with men, there's only one option. And so if they need a minute, that's great. But it's always with consent and explained what's going on. And usually people are desperate by the time they get a referral to a pelvic floor physical therapist, and they're just like, I'll do whatever, I just want help. So,
are there options for examinations without the internal aspect if people don't want to do that?
Yeah, for sure. I mean, again, on these little models here, this is the female. So we have all of these muscles right here that I keep showing from the outside. Here's the vagina and here's the anus. You can get a lot of information simply by touching this area right here between the vagina and the anus. And on the men, just the perineum. So this area right here, so just that central area. It's sort of the area where everything is connected. You have the meeting of all of these superficial muscles, the sphincter around the anus, and then it's also a big area of the deep pelvic floor muscles are just right above that area. So you have a lot going on right here. There's a lot you can access simply by doing perineal massage or just some gentle pressure to this area, which you can even do with your underwear on. I mean, you can easily do this yourself at home as well. Is just massage this area, or even just apply some pressure while you're breathing. Gentle pressure. Usually less is more. So you don't want to poke at it. It's more just a gentle massage and pressure.
Okay, that's great. We have a few other questions about bladder and pelvic symptoms. One was whether abdominal bloating can actually be caused by a pelvic floor issue rather than a digestive issue.
Yeah, so I mean, this is a chicken or the egg scenario potentially. First of all, if your pelvic floor is tense, let's say, that can actually cause problems with elimination. So it can make it harder for you to open up and have a proper bowel movement.
Hmm.
And so then if that's happening and you have a backup of waste in your bowel, then that will cause abdominal bloating. So that's an instance where the tension could cause the bloating.
Okay.
Um, but also issues such as just inflammation in the area can cause bloating. And so if you have an injury in your pelvic floor, if you have inflammation for any
Hmm.
reason in your pelvic floor area, that can cause bloating and congestion in that area. Um,
Okay.
yeah.
Is there a way that you can differentiate between whether it is digestive or a pelvic floor issue? Or is it necessary to kind of see someone about that?
I mean, I think that it's important to differentiate like which is the root cause
Hmm.
you're asking.
Yeah.
I think it's important. It's like this ball of yarn that's going on. Actually, there's a video today on my YouTube channel that talks about this. Pelvic floor issues are usually multifactorial.
Hmm.
Chronic pelvic pain syndrome, issues like, chronic UTIs is often multifactorial. It's like,
Hmm.
what caused it? There's a lot going on by the time somebody usually gets seen when things are chronic,
Yeah.
and a lot is interconnected. And so again, chicken or the egg, it's
Hmm.
potential that if you have gas and bloating, then that can cause your pelvic floor muscles to tense up as well. Or the tension in the pelvic floor can cause the gas and bloating. So I think it's going to be really individual. I think you want to figure out all of it.
Yeah.
Ultimately, you want to figure out all of it.
That would be ideal,
Yeah.
definitely.
Yeah.
And for bladder retention that's caused by prolapse or inflammation, are there methods that can be implemented to help encourage more complete emptying of the bladder?
Yes, for sure. One of my favorite things to teach people to do is what I call a pelvic rock.
Hmm.
So if you are sitting on the toilet, your bladder is right in there,
Hmm.
and you can think about you can think about tipping your pelvis slowly forward, and not like really fast, but just gently rocking your pelvis forward. And some people actually like to tip all the way forward, maybe even placing their elbows on their thighs, or you
Hmm.
can tilt your pelvis and just letting your muscles settle and relax, because again, the muscles do surround the urethra. And so you want to give your muscles a second just to kind of settle in and
Hmm.
let go. And this changes position of the bladder. I think of this as sort of siphoning out every last drop. It's changing position of all the pelvic organs when you
Yeah.
do this. And so then you tip back and do the same thing and let everything settle, let the muscles relax. It tips the bladder into a slightly different position and the rest of the pelvic organs into a slightly different position. And you might get more out that way as well. So just a couple tips back and forth. Some
Hmm.
people even like to tip side to side a little bit, and
Okay.
that can help. And then when you feel like you have more complete emptying, then if you want to, you can do a single Kegel, like a squeeze and lift, maybe hold it for 3 to 5 seconds and then let go, and then stand up and leave the toilet, just so
Okay.
that, yeah, so you kind of complete the process.
Right. Is straining to pee consistently going to cause long-term damage?
Yes, yes. And this is a really common, I mean, I always say don't push to poop and don't push to pee as much as you can. And,
Hmm.
every once in a while it's fine. I mean, we don't want to, but sometimes life happens and we're really in a rush and we feel like we have to push to pee, or we're constipated and we have to push to go
Hmm.
to the bathroom. But it's like, if you do that consistently because you always feel like you're in a rush, then that is a signal that you need to sort of look at your lifestyle and figure out how to calm down a little bit, because you need to give yourself at least 30 to 45 seconds to just let the urine flow out without pushing.
Yeah.
It's really important. If you do it every time you go, then everything you do that push downward pressure on your pelvic organs can contribute to prolapse.
Okay.
So that
Very
adds up.
important.
Cumulative. Yeah.
Yeah.
Mhm.
On the other end of the spectrum, a lot of the time with chronic UTI, people end up needing to pee a lot. And even if the infection has cleared, sometimes they're left with this constant need to pee. Can you explain why that happens and why it's important to somehow overcome that?
Yeah. Um, what I recommend in this case, because oftentimes what happens is you can feel like your bladder is the size of an acorn. You can
Mhm.
say, no, truly, my bladder just doesn't hold anything. I always have to go. But usually it's not actually the case. It's just that your bladder has gotten quite sensitive to filling. And
Mhm.
so oftentimes what can help people is a bladder diary. So bladder retraining by
Mhm.
using the bladder diary, tracking when they void and how much they void, and then trying to slowly, just like I was saying about exercise, you don't want to dive from going every 15 minutes to I'm gonna make myself wait 4 hours to use the bathroom again. It's
Right.
not like that. It's very slowly over time trying to lengthen the time between voids. And so you can do that. You can measure your output if that's helpful for you, but you don't have to do that. I mean, the main thing is just trying to slowly lengthen that time. If you feel like, no, like legit, I've really got to go to the bathroom, but it's only been 15 minutes and you've only had a small amount of water,
Mhm.
again, it's like, no, it's like you just have to use your mind to overcome this. And sometimes doing a Kegel or two or three, uh,
Mhm.
fully relaxing afterwards, but doing a Kegel, relax, Kegel, relax, Kegel, relax all the way can help send a signal to your brain that now's not the time. The bladder can calm down and it can help kind of reduce that sensation of needing to pee.
Okay.
If you have a very hypertonic pelvic floor, then that might not work for you because anytime you do a Kegel, it might irritate things.
Right.
But it's just a tip that you can play with a little bit and see if it helps you kind of ride that wave so that you can try to force yourself to wait a little bit longer to go to the bathroom, maybe from 15 minutes to 30 minutes. And
Mhm.
then over time it can be to 45 and then an hour. And ultimately you're wanting to wait 2 to 4 hours between each void.
Yeah, this frequency urgency can also impact the quality of sleep, and that is a huge problem. I mean, are there positions that you can sleep in that might help to relieve that so you can sleep for longer?
Yeah, I mean, you want to sleep in a position that has your body in a good alignment. So, sleeping on your side with a pillow between your knees can be helpful. Sleeping on your back, where some people just find it comfortable to sleep with the pillow under your knees. Anything that helps you be in good alignment and get really solid rest and
Mhm.
sink into a deep sleep is going to be helpful. Um,
Okay.
I also recommend, I do actually have a video about overactive bladder and some exercises for before bed, and it talks about sleep positions at the end. Uh,
Okay.
so,
I can find that one, link
yeah,
to it as
yeah.
well.
Mhm.
And bladder incontinence is also a symptom for a lot of people when they have UTI, but it can be caused by other things. Can you explain like the hypertonic versus other pelvic floor dysfunction and why that might happen?
For bladder leakage,
Yeah.
yeah, so bladder leakage usually is divided into stress incontinence and urge incontinence, or you can have mixed where you have both.
Hmm.
And so stress incontinence is where you cough, sneeze, laugh, and you pee a little bit or jump, that kind of thing. Urge incontinence is when you're rushing to the bathroom and you just can't make it, and usually it's
Hmm.
a big rush. Whereas urge incontinence can just be a little, or excuse me, stress incontinence can be just a little trickle. Um, Mixed incontinence is when you have both. And so sometimes these are issues, and this is where it's really good to go to a pelvic floor physical therapist who can evaluate you and determine if your muscles are in fact
Hmm.
hypotonic, they're weak and just not working well. So that is definitely something that can happen. um, Maybe they're just uncoordinated. You don't really know, like you've lost these natural reflexes that our bodies do have when we're kiddos, but then over time with aging, with giving
Hmm.
birth for many people, it can cause changes. Sometimes where our muscles are stretched, sometimes there's birth injuries,
Hmm.
sometimes we have nerve damage even. So that's something to be evaluated. Or maybe your muscles are overly tight, and that's another reason why they're kind of squeezing around your bladder, squeezing around your urethra, and they're not coordinated because they can never let go enough to get some rest. So they're
Right.
always tight. They're constantly exhausted and they're just not working well to contract
Hmm.
and relax.
I suppose the exercises that will help depend on what the problem is in the first place.
Yeah, it really does. And again, that's where getting that evaluation can be helpful. Sometimes with awareness, like this type of information, you can kind of have a sense in your body of what you think might be going on.
Hmm.
And if you think that, no, like I know, I mean, you can even use a finger and you can examine yourself. Like you can, I recommend going to somebody, but you can examine yourself and see what happens when you squeeze and lift your pelvic floor and when you relax, when you do a Kegel.
Hmm.
What can you feel? Do you feel like there's tenderness, tension, tightness? Do you feel like maybe you can squeeze, but you can't relax?
Hmm.
That's probably too much tension. If you
Okay.
feel like you've got a good squeeze and lift and relax, then it's like, well, work on that some more. That might help to do some more Kegels and to do some more core work while you're integrating your pelvic floor into that core work, or to do some more butt strengthening exercises and hip strengthening exercises.
Mhm.
Um, and if you are just completely hypotonic, where there's like nothing and you feel really like loose and just nothing happening there, then that's one where you can also try to access the pelvic floor. You'd probably want to do those exercises lying down on your back and see
Okay.
if that can give you a little boost to lie down, maybe even with your hips up on pillows, to help kind of help make it even easier. Give your hips up so that gravity is helping you use those muscles correctly.
Is there anything else you can add for bladder leakage during sex?
Bladder leakage during sex. So it's just going to be a matter of building up strength over time with the information we've been talking about.
Mhm.
It's going to be also a matter of being sure that you're not bearing down during sex, which can happen,
Okay.
especially if you're not breathing, if you're holding your breath, which can happen.
Mhm.
So I would encourage people to breathe. I would also, sometimes during orgasm, there can be bearing down that occurs, and that can contribute to bladder leakage.
Mhm.
So just being more aware of your body. In some cases, there can be a bearing down type of orgasm, that sensation. You might just want to allow it and just allow for some leakage.
Okay.
Or you can actually change that up with some awareness and control. You can change the contraction that's happening in your orgasm. You can actually add a bit of a pelvic floor lift rather
Okay.
than that kind of bearing down sensation, because orgasm is contraction of your uterus and your pelvic floor muscles. And so things are contracting. But if you kind of intentionally lift the pelvic floor versus only allowing that bearing down, or only sort of thinking about that bearing down, that might help as well.
Okay.
You can also
Interesting.
change up positions and that kind of thing too.
Yeah, that's really good advice. I think
Mhm.
a lot of people will be interested in that.
Yeah.
That was the last question that we had.
Oh, wow.
So
That was amazing. That was
yeah,
rapid fire.
exactly
Okay,
on time.
that's for it all.
So thank you so much for providing those insights. I think it's really helpful.
You're welcome. Thanks for having me.